Good afternoon and welcome. Thank you so much for joining us today. Today is Wednesday, August 12th, 2026, and we are here today in the conference room for the County Commissioners of Larimer County at our Administrative Services Building for a convening as the Board of Social Services. And we are here on the second floor. I am Larimer County Commissioner Chair Jody Shattuck McNally, and joined at the conference table by Commissioner Stevens and Commissioner Kafalis. Also joining us is our County Manager, Lorenda Volker, and our Assistant County Manager over there on the side, keeping an eye on all of us, is our Assistant County Manager, Lori Hadrich. So I'm going to just turn this over to our Director of Human Services, Heather O'Hare, and we have a whole side, the other side of the tables of this conference table is filled with amazing staff and dedicated staff who will be presenting today. So Heather, I'm just going to turn this over to you. And before we start, knowing that we have a little bit of time together today, would you like us to hold our questions till the end and get through all the presentation, then have the discussion and questions at the end, or how would you like to proceed?
Thank you, Commissioner. I would say ask your questions throughout, and we'll just sort of guide the conversation and watch the time as we go.
Great, and I will, as the commissioners raise their hands, I'll call on them if they have questions. Thank you.
Thank you. So again, Heather O'Hare, Human Services Director. I am going to do really quick introductions of my team one more time, and then we'll get started. So I'll start with you, Kayleen.
Good afternoon. My name is Kayleen Rowley, Business Operations Coordinator.
Good afternoon. My name is Kim Muller. I'm the Division Manager for Benefits and Community Support.
Good afternoon. I'm Shannon Reef, the Human Services Deputy Director.
Afternoon. I almost said morning for some reason. It's been one of those days. Thad Paul, Division Manager of Child, Youth, Family, and Adult Protective Services.
Hello, everyone. Jonathan Anderson, Division. Am I on?
Yeah.
I am on. Division Manager of Operations and Organizational Development.
Welcome, everyone.
Thank you. Any additions to the agenda before we start?
I have not been made aware of any changes to the agenda. I think we can proceed as published. Thanks.
Okay, thank you. So we have, like you said, a lot on the agenda. We want to make sure to give you all of the updates related to HR1 and all of the work happening locally and at the state level. We always have our semi-annual fiscal presentation in August. So where did we close out for the year prior? And then what does our state and federal funding look like for the state fiscal year that's just started? And then we're going to wrap up with sharing some great success from Thad's team. So let's jump in. So we have a lot happening related to HR1, the federal law that was passed last July, as well as a follow-up state legislative item and a lot of related projects. So want to make sure that you have an update on the work that we're doing through our partnership with the American Public Human Services Association to gear up for a lot of those changes. Talk through the most current information related to the payment error rates and the work happening around there, and then the cost share conversations on the fiscal penalties that are going to come with those error rates. Dig into House Bill 261429 and talk through the implementation working group and the centralization of program integrity. We're going to highlight and share with you how we're preparing staff. Most of those changes are still coming, so what are we doing to make sure our team is prepared? And then just some recent federal engagement with our congressional leaders. So I included a timeline in here really just to orient anyone who might be listening. We've had a lot of conversation about the key milestones of these changes. So a couple of the changes have already happened. SNAP changes actually started with expanded work requirements and changes to immigration last October. Changes to the state budget that we'll cover in our fiscal presentation. But then really, what are we preparing for? It is still the bulk of the changes are still yet to come. So in October of 2026, the federal cost share changes for the administrative funding we receive to administer SNAP and then immigration changes for Medicaid eligibility. And then really next year is when significant changes come again with that ongoing administrative reduction in the food assistance funding, but new and extensive work requirements in Medicaid, as well as a 6-month recertification change where about a third of our Larimer County Medicaid recipients will have to recertify their Medicaid twice a year instead of once a year. So it's about 22,000 of the 62,000 in the Larimer County community that receive Medicaid that'll be impacted by that. And then obviously additional changes that we're monitoring that might come with the president's proposed budget that would also have other fiscal changes to some of our other funding streams and programs that we administer. Okay, so what are we doing locally? So we've shared about our partnership with APHSA. Again, it's the American Public Human Services Association. It is one of the largest human services associations nationally. They represent state-administered states, so they represent all of the state departments of human services, but then also the 10 county-administered systems in the 10 states where it has a little bit different structure. They have fantastic technical assistance, lobbying leadership, as well as just programmatic subject matter expertise. And so we have partnered with them, I think, going on 10 years now. And every time we come to them with an idea or a need, they help connect us with other counties and other states nationally, but also then share in their expertise and their resources. So they have been developing, it's revising their equity, diversity, inclusion, and belonging model, has revised and is now the community and social impact model, very similar to collective impact, which is a model that's been used locally for a long time here in Larimer. But working with us then to utilize that model and build a local strategic plan for how we are going to adjust to all of these changes. And really the overarching goal is two things. For individuals who are eligible but not yet accessing the services, that it's still clear of how they would access those services and be able to access the support from SNAP and Medicaid, even with these changes and some of these procedural steps looking different. And then the second goal is those that are receiving the benefits today who continue to be eligible, that they are not falling off of the benefits then when these changes hit. So, again, utilizing that model, developing a 12 to 18-month roadmap, and we started this work in January. So we're about 6 or 7 months in and wrapping up our phase 1 of the work. So phase 1 has included several listening sessions. A really key tenet of the CSI model is making sure that those that are accessing the programs also have a voice in what the process and the decision-making looks like around those programs. So the listening groups were done with individuals who are receiving these benefits, our line staff who were helping to process the eligibility for these programs, our managers, and then a fourth listening session with community partners to share more about the collaboration and the partnership and how they help navigate the system for those that they're serving. We then have also had 2 large convenings. So we brought together a group in June and then brought together an even larger group in July. And those convenings were really focused on the training around the model, but starting to then use the model in practice to build this action plan. We've had over 50 different partners come to the table, so we've included several pictures from those convenings, community partners, other human and economic health departments, as well as many of our neighboring regional county peers. We had Boulder, Weld, Denver, several of our Adams County, so several of those regional partners also as they're thinking about how to navigate this. And we are very close to having a first draft of the Medicaid component of this strategic plan. And then we will, a lot of those elements will also relate to SNAP. So then we'll shift focus a little bit and develop one specific to SNAP. And we should have a final report here in the next couple of weeks on those phase 1 activities and then what's to come in phase 2. So phase 2 is, we're really rolling into phase 2 seamlessly. So it is, what we heard loud and clear is that increased communication and increased education amongst our community is needed on the impacts of these changes, but also what are we doing about it? What are we doing at the state level within our team? And how can those community partners help then in sharing the changes that we're all going to have to navigate? So we're having a lot of conversation about communication and what that ongoing learning looks like. And then again, structuring, we will have sort of 2 project arms, if you will, one that's specific to Medicaid, one that's specific to SNAP, with a lot of overlap. But there are some nuance of the changes to the different programs that it requires different strategies. And then we are structuring it very similar to the Larimer COVID Recovery Network that came out of your work and the leadership of many of our county department leaders to respond very quickly to the pandemic across all of the different sectors that pandemic had an impact. So we're using that sort of as the structural framework to replicate here as we think about these strategic plans. And I included there the visual of the model so you can see the 5 key tenets of the model. Starting with leadership and capacity building, making sure that the leadership across the community has the capacity, has the consistent information of what's coming, and can then deploy that information in the different spaces where they are performing. Safety, health, and well-being. So what are the specific changes that are coming and how will that impact the broader ecosystem of safety and well-being? And then community engagement, social and economic mobility, and then certainly technology, data, and innovation. So we have action steps drafted specific to Medicaid that fall in those 5 different areas and have already started to identify community partners who are going to co-lead each of those sections of the plan together so that we are sort of deploying these action groups out and then making sure that we have a governance structure for coming back and sharing what's happening, where there might be redundancy, and making sure that everyone's on the same page. So I'm going to
pause you right
Sure.
there. Commissioner Stevens has her hand raised, and then Lorinda, did you have? Okay.
I'm sorry, maybe you wanted to finish your thought. No, okay. So just, first of all, this is great. Really happy to hear this is happening. Are other communities sort of employing this model with the American Public Human Services Association? Are they doing this same work?
So, not any locally that I'm aware of. For the last section of the slide, I'm actually going to turn it over to Shannon. So I'm going to have Shannon answer that question because she presented on this model and our work related to this at APHSA's national conference in June. So she can share the other states and the other jurisdictions that are taking a similar approach.
Yeah, because I think this is really great to really think about this community-wide, and I love that kind of approach of educating the community on what sort of we're facing and what our residents are facing. They're probably aware of the financial, is that a piece that we're sort of like also, this is all happening and everything's going to cost the county more kind of piece. Do they our partners at least understand some of that?
Yes, we are weaving that in. I would say in the initial 2 convenings, the impact of these changes were actually surprising to even our community partners that were joining for this conversation. So some of our Medicaid providers, the food bank, other food security partners didn't understand the total impact. So like I said, we need to communicate more frequently and also put together, I think, some communication resources of here are the data points and the facts based on what we know at this point, and send those out so that people have those too.
Yeah, that's great. Because I mean, at the state level, when we're working on some of this work, we know that there's a couple of big quite large providers that are, or nonprofit providers that are there at the table. But I'm really glad that at the local level, especially for us, some of those providers that are more active in the Denver metro area aren't necessarily as active here. And so I just really glad to hear this is happening. Thanks to all of you for the work on this.
Thank you. So I'm going to ask Shannon to answer your question about other locations.
And then I'm going to have you do that, and then Commissioner Cafalas has his hand raised, and then, but I'll have his question after Shannon answers Commissioner Stevens. Thanks.
Go ahead.
Thank you, Commissioner Stevens. So I did have the privilege of presenting at the APHSA national convening, and we sat on a panel with New Jersey, Virginia, and North Carolina, and all three of those jurisdictions are implementing this. One of the beauties of this model is that it's so easily trainable that any community organization that participated in the training that we had here can take it back to their own organization and use this model to solve other issues that they might be facing. So that's one of the reasons why this model was chosen and why it's such an incredible asset to our community.
We should encourage our Colorado counties too, maybe.
We have asked APHSA included in their final report to also walk through what did we do, so that other community partners, other counties can take it and say, well, I have resources or I don't, but here's where I can start based on what we've learned. So some of those lessons learned too, we're going to have documented that we can share.
So I want to circle back to that. It's my question, but first, Commissioner Cafalas.
Thank you, Madam Chair. Thank you, everyone, for the excellent presentation, how it's been organized. I have two questions. One regarding the CSI model, which is great. I wonder, does it include, in terms of the 30 community-based partners, is FLTI involved, the Family Leadership Training Institute, through CSU Extension?
So we have CSU Extension that did not come to the convenings, but are included in sort of the ongoing updates. FLTI was not directly involved, but there were other advocacy groups or advisory boards is the better term. So Healthy Larimer, there were other advisory boards that we had included in the convenings through the organization that they are affiliated with, but not FLTI directly.
If I may follow up, it seems like someone like Lisa Auer should at least be, I would assume she's aware of these efforts, but she would be someone to connect with to make sure. I don't know if they're going to be doing a class in the fall or next year, but I think the folks who participate in FLTI are likely, there's an intersection between how they're trying to get by and some of these changes. So thank you.
Yes.
My other question really quick is just to go back to the timeline, please. You don't need to pull the slide up, but there was a reference to October 2025 last year, the SNAP work requirement changes and also the immigration eligibility changes. Would you clarify, please, when those took effect? Because I thought the changes were established, but I didn't think they took effect until more recently. Maybe I'm wrong.
No, you are correct. So the work requirements and the immigration changes for food assistance have already happened. The ones for Medicaid are still coming. But the way HR 1 was written was that they actually became effective on the day that it was signed, which was July 4th of 2025. Okay. But there was such a delay in the policy guidance from Food and Nutritional Administration, formerly Food and Nutrition Services, down to states and counties that we didn't have any information to actually implement them. So it is much more recent than that policy direction, while still not incredibly clear and in some areas still pretty vague. The policy direction was much slower to come, so the changes hit locally more recently than when they were actually effective.
Like June 1st or something?
June 1st, well, the work requirements were actually November of last year when we received some additional information. The food assistance immigration changes, though, were just in the last couple of months.
And finally, related to that, I assume we're working closely with our workforce development folks, because when I asked them are we starting to see a surge of people who need some assistance or support in figuring out about jobs or volunteer opportunities or education, that there would be a lot more people coming into the office on the 5th floor. Can you speak to that? Then I'm done.
So the vast majority of people receiving these benefits are already working.
That's what I thought.
So we are trying to understand the data to really figure out where that, I think there will be a surge, certainly with Medicaid. But I think the surge is more likely to hit our staff rather than Economic and Workforce Development Department because they are already working. And so then it becomes our requirement and responsibility to help them figure out how to document that work. There will be, I think, the majority of them who do not need help finding work. We're trying to figure out really where that impact is going to be. And Mark Johnston and his team are certainly involved and we're at the convenings. The biggest issue I think we will likely see is that we don't have any infrastructure or tracking of volunteer opportunities or volunteer hours. So that is something that I anticipate will actually come out of this strategic plan is how are we going to track volunteer hours? Who has volunteer opportunities? And then what does the documentation look like? So that's where I think the biggest gap will come is actually in the volunteer hours.
Thank you.
Well, first, really pleased and proud that you were presenting and that we're sharing this other information because I think we're all in this together, unfortunately, but fortunately. My first couple of questions are, it looks like this convening was held here in, was it part of it held here for the convening for the partnership? Is that?
The first one in June was at 1501 Blue Spruce, and the second one was in the Loveland location.
Okay, because I thought I recognized the Loveland one. Secondly, when you talk about modeling after the COVID recovery network, can you back up and just kind of walk me through kind of the why or how, or did we just, I know you were kind of involved with that, and then I know you've been having more human services involved with our response to wildfire evacuations and being at the sites for evacuees. I know you've been your department's been getting more involved with that. Can you kind of walk me back at how that kind of led us to this place of modeling and after the recovery network? Is it just because we had those groups already kind of connected and they've still been kind of loosely convening still, or what kind of drove that? I know you kind of shared that, but I wanted to maybe expand on that a little bit.
Yes, and I'm realizing I may not have explained it very clearly. So we are not utilizing the same groups. They are entirely new groups, although a lot of the same community partners are at the table. We're just using the structure and the approach around, I would say, more the project management side of it, of how did we manage such a large-scale community impact that was going to hit the heart of our businesses and people's ability to feed themselves and see a doctor. So how do we take that same scale and impact of a project and try to structure it then with making sure that as we're pulling together all of these people, we have the capacity and the ability then to make sure everyone is aware of what's happening with more of the project management structure. So it's really just using the structure and having then, when we think about the Medicaid response plan is really what we should call it. The Medicaid response plan will likely have a different group that is figuring out how to stand up and track volunteer opportunities than it is for figuring out how to ensure that people understand they now have to reapply to keep Medicaid every 6 months and deploying action groups to the specific strategies, not necessarily leveraging the same teams and the same resources, but just the structure itself that I was not overly involved because Laura Walker was so fantastic at her involvement in the recovery network, but the structure, I think, made it a bit more manageable and able to let people go and start building these action steps because everyone is on the same page and knows what we're we're trying to combat or trying to achieve. So it made the management more feasible.
And nimble, maybe. I
Yes.
guess. So feasible and nimble. And then my next one, real quick. You mentioned, Shannon, that New Jersey and North Carolina, Virginia, and was there one more, or was that us? Just us four?
Yes,
Okay. But Larimer County, not all of Colorado.
Correct.
So I wanted to point that out. Is this, so those three other states, are they, I happened to learn about Virginia, because that's where my child's doing her PhD, is every county's different. Every county does something different there, even when it comes to emissions tests and things. I find that really the hard way. So I'm curious about, with that, knowing that's how that state operates, is that similar? Is it just certain counties in each of these states that are collaborating? Or is it the whole state kind of working with us? Or are these areas four counties or groups of counties or each one working together? I'm curious about that.
yes, thank you, Madam Chair. It is actually individual counties
Okay.
for each of those different states that we're presenting on the panel.
So my next question would be on that. How did you find each other? And the reason I ask, just to kind of say that, is because I know when the state started looking at how to restructure, or we're going to restructure, when that all came down, they pointed on one state or something and thought, this is the model everyone's following. And that seemed to be more of a top-down. This seems like you guys are fronting each other from the bottom up, and I'm curious about that.
So, interesting question. These other three counties we have actually worked very closely with for the last 6 or 7 years. And when we hosted APHSA 3 years ago now, so they have APHSA structures themselves with a state cohort and a county cohort. So all of the counties get together twice a year for 3 or 4 day retreats, but then also monthly meetings. So these three directors in particular have actually come to those retreats when we hosted in Fort Collins. We've worked very closely with them. But the partnership and the connections that APHSA have, they work very closely with NACO as the National Association for Counties and the Human Services Administrators Association that is sort of an offshoot of NACO. So it is, I would say, it's a small world in a very large country of many counties doing this work, but there is a really close group of probably 15 to 20 county directors that we rely on all the time. We are actually going to connect back with Virginia. Dr. Michael Beckett's is the director there, and he has done a ton of work around technology and external communication so that his community really understands the impact and what they're doing related to it. So there's individual strategies too that will go back to that same group and learn from them again.
I find it remarkable. The reason I mention that is 15 to 20, and you all work together and through NACO when there's 3,069 counties in the United States. So that's the reason some of my question is how, this is really interesting but very relevant. I think that you all are trying to find, you have known each other and trying to find ways to work together to find solutions, because I think we're finding other ways of other people trying to tell us how to do it is not been fruitful. So that's the last of my question for now, but I just wanted to kind of back up on that a little bit to understand how we got here. So thank you for that.
Yes, and we are relying on that same close group to also do our own research on the cohort restructuring, and we go back to that group for all different topics and to pick their brains just as they come to us with lots of questions.
Cool.
So before we move on to the other HR1 updates, I want to have Shannon speak to the initial feedback we've heard so far from community partners following the 2 convenings, and so that we're sharing with you of how we're taking that feedback too and revising then the plan for phase 2.
Thank you. At the end of the convening on day 2, we went around the room and asked everyone, can you share a word or something that you've learned? And everybody in the room was so excited. They were sharing words like invigorated, excited, hopeful. And one of the biggest sentiments was, I feel like we're actually walking away as a community with a plan. So we've got all of these action plans. We know we're going to follow through on it, and we're not alone together. And we can continue to serve our community the best way that we know how, but as a cohort, as a group, not just trying to do it individually in each of these different organizations. So it was wonderful to hear that feedback. And then in the surveys that APHSA had every participant do, we also heard the same thing. 95% of them were feeling confident or very confident in this work, in the model itself. And then also in the assessment phase, when we were really identifying those barriers and how we were planning to address those and some of the root causes. So we were excited to hear that feedback and know that our community is on board with moving this work forward.
Okay, thank you, Shannon. All right, so shifting gears a little bit to another component of HR1 is the changes to payment error rates and the cost shares. So I included this infographic here. I was part of a presentation last Friday to the CCI Association and the Front Range District meeting where they hosted several legislators. And we used this infographic as part of that presentation. So at the, in HR1, the payment error rates for SNAP, which we call PER, and the payment error rate methodology, or we call PERM for Medicaid, they mean the same thing. They're just measured differently, and because they come from two different arms of the federal government, they want to call themselves something different. But they really are measuring the error rates in the eligibility and the benefits that come from these two programs. And HR1 is highlighting that and also making some pretty significant structural changes so that there are fiscal penalties to states when the PER or the PERM are too high. So we are currently in the measurement period for our payment error rate. The PER changes will hit first, and the PERM changes for Medicaid won't come until 28 and 2029. So we used this graphic really just to highlight that there is no disagreement whatsoever between counties and the State Department that we have to reduce our error rates. If we do not reduce our error rates, there will be significant fiscal penalties. And because we are in the measurement period is the federal fiscal year, so October 1st of 25 to September 30th of 26. We have to reduce our error rates below 6% by September 30th, or we will have a fiscal penalty then that hits in 2027. So, like I said, there is no disagreement that this is a priority and it is a goal. The challenge, though, is the alignment. There is not a whole lot of alignment in how we reduce the error rates. And so, unfortunately, we have not made a lot of progress in the last 9 months, and we will not have our error rates below 6% statewide. So the reason, though, that there is that misalignment is really what drives the error rate, and then what strategy do we implement to reduce that. There is a significant disconnect in the processes that we are required to follow and uphold when we process eligibility on the front end that look very different from how the state's quality assurance team reviews and audits the case on the back end. And so we're trying to draw more alignment between that, which will result in policy changes needing to be made. So on the next slide, when we get into our own individual error rates, I'll give you a couple of examples, but that's really where the lack of alignment and the mismatch is in these state conversations with the partners and the governor's office and counties. And then, like I shared, the consequences of inaction are upwards of $150 million in the fiscal penalty for 2027. So it is not a small amount. It would be 10% of the benefits cost. So Colorado issues between $1.3 and $1.5 billion in SNAP benefits in the year. And so we would have to then cover 10% of that cost, whereas today states and counties don't cover any of the benefits. We're responsible for covering a portion of the administration, but not the benefits. So I just shared that because I think it's a really good infographic and wanted to make sure that you all had it to show sort of the challenges with where we're at right now. So House Bill 261429 required a continuous quality improvement committee that is intended to impact both the SNAP and the Medicaid error rates. So the State Department of Human Services, Healthcare Policy and Financing, as well as the Department of Early Childhood, and then counties are all partners in this committee. We meet monthly. I am the county chair. And so then parallel to these state meetings, then we have a county subcommittee that has 20 different county reps from all of the different regions of the state. So we're taking ideas from the state meetings back to that county group, doing a lot of research and analysis and bringing it back. Like I said, so far we've been very focused on the SNAP error rates because that's what's coming first. But we know that anything we change in SNAP will impact how we process Medicaid because we don't process them in silos. We do it all together. One of our staff on Kim's team is responsible for processing those two programs at the same time as they're working with that community member. We don't have specific SNAP workers and specific Medicaid workers. They process eligibility and screen individuals for any of the public benefits that they might be eligible for. So we have to be very cautious as we make these changes so that we're not unintentionally causing the Medicaid error rates to increase in the future. So while we have had this focus on error rates in the last 12 to 18 months, we have seen the error rate go down statewide. Unfortunately, it really is just because we are having so much of this conversation. We really can't pinpoint it to any specific strategy or change. It's just counties really trying to dig in to understand what's causing the error rates. So Colorado's error rate has gone down from 10% in October to 8.4% in July. But again, we have to get it below 6% in order to avoid the penalty. So we're trying to identify those strategies then to decrease it another 2.5% as quickly as we possibly can. So I'll pause there for questions.
Commissioner Gonzalez, your hand is raised.
Yes, thank you. Are we using the same methodology as the feds were recommending, or are we using something that perhaps sheds more accuracy on the issue?
We are not using the methodology for a couple of reasons. So the methodology at the federal level, they pull 1,200 cases of 650,000 statewide. They have assured us it is statistically significant. I don't understand how it is when you're pulling that few. But they also pull any case that's open. It doesn't matter how long it's been open. So some of these individuals applied for food assistance 5 years ago and have continued receiving the benefit. They are going all the way back to the application 5 years ago and re-investigating, did we process it accurately 5 years ago? So one, the state and counties don't have the resources to do that. That would drive a lot of work. So we're trying to, we have an internal CQI committee that's mentioned down in that next section. We are revising our local quality assurance efforts, and we are pulling a randomized sample within 30 days of providing the benefit, so that if there is an error, we can course correct very quickly before it might come up when the state pulls it at some point in the future. So we're trying to be more nimble than the federal process.
In terms of our, just a quick follow-up, in terms of our requirements to provide the information to the feds, if we're not using the same methodology that they're using, and we're seeing a reduction in payment error rates, will they accept that?
So let me clarify that. So the State Department has a team that is using the required federal methodology. Because of their own resources, they have not been open to expanding the number of cases they pull, because that would also drive significant staffing resources for them. So they audit the cases and provide the data back to the feds, and then the feds say, yes, we agree with your data, or we don't.
Okay.
And there is a lot of conversation happening right now because in this most current measurement, the federal office did not agree with several counties' data, and they are adjusting error rates up. So the State Department is trying to understand why our error rates were increased from what the state submitted.
Thank you, Madam Chair.
That is interesting, because we did have a 0 error rate for a period of time here for Larimer County, right? We've had that a few months, I guess. But you're saying what the federal government is claiming is higher than what the state is sending in, is that?
Yes, so the State Department submitted our error rates at 8% in June, and then the federal team reviews it and reconciles it and responds back and says, yes, we agree, or no, we don't. And they have come back to us and many states and said, no, your error rate based on our review is actually higher. So there is talk amongst many of the states that there might be additional litigation because the states have not been able to get more information on how they were adjusted and why.
Okay. So that's interesting that it already dropped since July, just for people maybe really slowing down and trying to really understand what's going on. But there's, as you're saying, there's probably not a chance for it to come down to where it needs to be and below 6 by then. So how can you remind me? Is it only for the year that would be the increase in paying the penalties or whatever, or would we have to? When would we be able to be? Would it be a year from now before they would look at the rates again? And how does that work?
So they will use October 25 through September 26 data to determine our fiscal penalty for 27 and 28. So it would be 150 million in 27 and 150 million in 28 because they're going to use the same data for both years. And then in 29, it shifts and it will be the 27 error rate that impacts 29 penalties. 28 error rate will impact 2030 penalties. So it will be 1 year that then determines the fiscal penalty. But in order to make this shift in both process and fiscally at the federal level, this 1 year is going to determine the first 2 years of our penalties.
Okay, thank you.
So our error rates, like you said, we have had several months where we didn't have error rates from Larimer County. From federal fiscal year 25, so October of 24 through September of 25, Larimer County's error rate was 8%. In federal fiscal year 26, it was 4.1%, up through July. So we are doing a lot around our CQI work to really try to impact where our error rates are coming from. The challenge, though, is that the error rates are driven by both county administrative work, but also client errors. And we have no control or policy decision-making authority at the county level to impact those client errors. So that's where the conversation, I think, has stalled a bit in these state level meetings around what percentage of the fiscal penalty should counties be responsible for. If Larimer County's error rate is below 6%, I would argue we shouldn't be responsible for any of it, but that's not how it's going to play out. But we know that 4.1% of our error rates for this current fiscal year is about 50% client-driven and 50% staff-driven. So even if our staff are performing perfectly and have no error rates, we will still have errors because of the client component. So I'll give you an example of where this comes from. Colorado leverages self-attestation for a lot of different areas of the work. So we are required, when we receive an application, we are required to take self-attestation from the applicant in saying, this is my household income. They self-attest that that is accurate. We are not allowed to verify their income. We are required to take that self-attestation and process the case as we normally would. When that case is pulled at some point in the future by the QA team at the state level, they are not allowed in their federal regs to use self-attestation for anything. They have to actually pull the pay stubs and pull the IRS data and verify and investigate that the person's income is an exact match to what they self-attested to. So there is a very clear disconnect in the policies we are required to adhere to in our offices every day and how we are audited at some point in the future. And that's what we are trying to drive policy change for at the state level. Unfortunately, we won't be able to decrease the error rates and continue with self-attestation in all of the places where we are today. Because we know that the client error rates are driven by their income and their housing expenses. They self-attest to what their housing costs are, their utility costs, and then when it is audited and verified much later in the process, a lot of the errors then are coming from those two categories. And so we've flagged all of those areas and really trying to drive for analyzing what the policy impact would be. It is going to be an increase in workload for us to have to verify income rather than self-attestation. But what is the impact of that workload? We are going to have to increase our responsibility and our workload to a certain extent in order to ensure that we don't have this massive fiscal penalty that is going to eliminate our ability to pay for the staff at all. And it really is that dire in the two different options that we're trying to advocate for and talk through with the state departments, the governor's office, and advocates. And Commissioner Stevens has been leading from Larimer County's perspective in really driving those conversations so that we're not just keeping status quo and continuing to operate a program that in the future the state can't afford to operate.
Commissioner Stevens.
Yeah, thank you, Heather. I'll just add to that, I mean, I think that there's a desire to keep self-attestations because it gets more people served. And certainly we understand the need for getting people served right away and serving as many people as we possibly can that qualify. The danger, though, at this point is sort of that the whole program falls apart and we don't know how to serve anyone. And so when you're sort of in that kind of environment, then I believe policies have to change. And that's those conversations that Heather is having at the state. You know, they're vetting, I don't know, 71 policies that could move the needle and get our error rates lower. We are in the cost share conversations trying to say, please listen to these policy considerations as, you know, because we can't, and making the case that counties can't afford a 40% increase. So tag team me go to these scenarios and really trying to make the case, and it's tricky, but I appreciate the work that you're doing.
Thank you, Commissioner Stevens. Commissioner Cafals, yes, I see your hand is raised.
Yes. Thank you. I'm sure you're aware, but on Friday at the State Board of Human Services rulemaking session, we did approve on first reading a rule that deals with some of the changes to H.R. 1. And one of the changes in particular is with the housing costs. Oftentimes, as I understand it, when people move and there might be a change in their housing costs, their sheltering costs, they don't report that. So I think there are some improvements there where there'll be an automated response to remind people that if there has been a change, that they need to make sure that the benefits folks are aware of that. So I just wanted to make sure you all were aware that took place on Friday. I guess we'll have second reading in September 4th.
Yes, thank you.
Okay, Heather, I know how are you doing on time? I know we have.
We're doing okay. We're going to speed up a little bit, but
Okay.
These are really important details too.
Yes,
So
and thanks for answering our questions. I think
Yes.
also we're all asking them or bringing this up because we really want people to understand This is very complex, but extremely impactful in not
Yes.
very detrimental ways. And I just
Yes.
think we need to really go slow to make sure everyone understands what has already landed and what is coming and how this is really going to impact us. And the folks that, most importantly, impact the folks that we serve. And that's why we're all here talking about this today. Thank you.
Yes, thank you. So I am going to go pretty quickly through these two components because we've had a lot of conversation about it. But House Bill 261429 is the restructuring legislation, again, that we've talked about over the last several meetings. So there's the implementation working group that Commissioner Kafalis was named to by the Gov's office that is doing a lot of research and analysis on what could be a more cost-effective structure. Do all 62 counties need to stand up the exact same level of service and duplicate services? Or is there a way to share in services, again, for that cost-effectiveness, but without impacting the service level for those that we're serving? So there's a lot of work happening there. Our next meeting is this Friday. We're meeting every 2 weeks with North Highland and all of the different members that were identified for that work. And then the other key piece out of House Bill 1429 is that program integrity or the fraud investigations and the recovery of benefits that might have been overpaid. We call that program integrity. That work and responsibility is going to be centralized at the state level, and the state is going to contract with one county to do that work statewide. So we should have that RFP, we've been told by the end of this week, but we've seen the draft RFP. The duties and the workload for that contractor will be significant. And counties have been very vocal that the money that has been earmarked for that work today is not sufficient to really operate that contract in a fiscally responsible way. But if counties are not doing that work, as we've learned, about 2/3 of the counties in Colorado are not doing that work today, it increases the risk and the liability then for the state as a whole, because this is an area of focus from the federal office. So we have to ensure that we're doing program integrity and recouping any benefits that might have been paid out to someone who is not eligible. So as we learn more and we know more from that RFP being released, we'll make sure that you have updated information.
Can I pause you right there? When you say 2/3 of the counties in Colorado are not doing the work,
Correct.
where do we know this from?
They've voiced it themselves.
Voiced it themselves?
Yes.
And this is about the program integrity.
Yes, just the fraud investigation and recovery tasks. And so it is, the large 11 counties are doing this work. It is really the rest of the state. And the reasons they are not doing it is because the allocations to date have been so insufficient that they can't pay for everything they're responsible for. And so they have had to prioritize in different ways. And program integrity is often program integrity and quality assurance are often the two that get set to the side when you have to prioritize resources, because you have to process those applications coming in the front door. So it really is because of fiscal constraints the counties have been very vocal about for many years.
Okay, that's helpful. Thank you. More to come. I appreciate that.
Yes. So I am going to turn it over to Kim and Jonathan. The staff that are directly impacted by all of these changes are in our Benefits and Community Support Division and our Operations and Organizational Development Division. And so as Kim and Jonathan have transitioned into their role or joined our team, they have been very intentional in their own onboarding and connecting with staff to be able to utilize those activities as they move into the role to also help prepare staff for all of these changes. So Kim's going to share what she's been doing, and then Jonathan will share what it's looked like for him.
Thank you. So as I have been in this role. I've been here for I've just hit my 2-month mark, which has been really beautiful. And during that time, I have really prioritized meeting each and every one of our benefits and community support staff. I believe that I need to have an intimate knowledge of the staff in order to advocate for the staff. By doing this, I've been able to hear where some of the pitfalls are, where some of the processes that we need to improve are. And it has been a really informative experience for me. In addition to that, I have began a journey to do eligibility training. So really understanding the actual training that our specialists are going through. So that is also something that I have been working on as I've come into this role. What I have found is that the more I get to know the staff, the better I get to know the work. And by doing that, I believe that it will help us as we're starting to implement these to understand where we might be able to improve things, where we might be able to hold things, but also, and really importantly, it's helping our staff feel seen and heard. And in addition to that, when they're feeling seen and heard, I believe that it is giving us the opportunity to hear things that maybe we hadn't heard before or things that we didn't know before. And so it's just been a really remarkable journey to be able to be a part of this team and to be able to lead these specialists who are doing such important work as we've gone through it. So yeah, yes, that's all for now. Thank you.
Welcome, Kim, again. It was good to see it in employee orientation. So, and now we're on to Jonathan,
Thank you.
right?
Yes, Jonathan.
Thank you, Commissioners. Yep, while I'm not new to Larimer County, going on 19 years with Human Services, I am newer to my role. Similar to Kim, I've been trying to really take an immersive approach and figure out how I understand I'm a new learner, but I need to be an expert really quick to be able to lead through these changes. So also created my own training plan where I am in all of the team meetings that are taking place, whether it's a normal agenda or team building activities. I'm trying to find ways to connect so I can build that trust and learn the processes. Also doing those one-on-ones with lead roles and managers to hear from their perspective and taking that opportunity to learn the role. So I'm building into our supervisions, like, teach me, like, can I follow you and shadow you for a day? I am shadowing line staff, actually sitting with them for an hour or two, looking over their shoulders, asking them questions about the processes, just so I can understand when we're making changes and seeing the potential impacts, how that actually affects the day-to-day work. And I still do on our in-person day on Thursday intentionally round. So it's a process we learned through the lean process years ago that Toyota does, where you actually just use your time, go desk to desk and just start up conversations. And I'm focusing on the impact and work so that I can bring those back to our leadership meetings. Intentionally being very active in state meetings. So myself and all of my leads are attending these state meetings so that we can be a presence there, push back, ask questions, and bring back that information in real time. And I'm also connecting with external experts. So others are connecting to me too, like, who's the expert in this area from another county? And so I'm actually setting time aside. We're going to Weld to talk about their quality assurance process on Friday. Kim's going with, and we'll just be actually just seeing how are you guys doing it, because we hear they're doing some really great things, so we can kind of steal some ideas. Like I mentioned with Kim, her and I, realizing we're new and have a really great opportunity to build that relationship, connect, create the culture, create the values and the opportunities. So we're having conversations about actually how much, like, can we start talking to each other's staff together? Can we deliver the same message at the same time so it kind of cohesively works as one unit? Our communication team is working on a communications plan as we speak, block pages, things like that were in the previous, right there. So that staff always have a place to go for the most up-to-date information. And our financial team is working on, like, creating a tracking process for how will HR1 impact us fiscally in the future, so we'll be able to report out that better as well. Our teams that are impacted the most, especially like the program integrity team, we have regularly scheduled meetings, whether we have an agenda or not. We're giving them a space so they can bring in concerns, comments, questions, and updates. And they have a question answer sheet that they constantly put questions in, and we seek out the answers for them so they're not waiting in the unknown. And then lastly, we're utilizing the county process improvement team, working with Joe, who is helping to actually look at these processes from an outsider view and figure out how can we make these changes that'll help with things like the per rate and things like that. So quite a few things, but I've mostly been enjoying the connective part and getting to know the staff and the roles. So.
Well, welcome, Jonathan, to your new role, and glad you've been here 19 years. That's really special. Thank you. All right, Heather.
Yes, so last but certainly not least, just some of the recent federal engagement. So Representative Evans reached out in early summer to understand our error rates, understand how they're measured, and gather all of that information so that he then actually wrote a fantastic letter advocating on behalf of Colorado that the error rate measurement should be delayed, and was able to really speak and articulate why that was going to be so impactful at the local level. You all have engaged with Representative Neguse and around the Farm Bill conversations. And then 2 weeks ago, Senator Hickenlooper visited, and I had the opportunity to moderate a conversation specific to HR 1. He toured the food bank, and we had several community leaders there speaking to how HR 1 is going to impact them, but then also the services for those that they serve. And the Human Services Directors Association sent a letter just last week to both Senators Hickenlooper and Bennett related to the Farm Bill and why it is so crucial that the Farm Bill not continue as it's been drafted and being discussed in committee, because that really is the last opportunity to impact the error rates and the fiscal penalties that are coming is in the Farm Bill. So we're continuing to track that, and we'll send updates as we have them.
Commissioner Cafalas, your hand is raised.
Yes, I just wanted to point out that Congressman Neguse is having a town hall in Fort Collins on Saturday, 12:30 to 1:30. That will include 3 of our state legislators. I signed up to attend. There's a sort of a registration process. I don't know where the location is yet. You have to register. But if you didn't get that, Neguse sends out a newsletter, an email. It was today, I think.
Okay.
And they asked if there are particular topics, and I asked for an update on HR 1 and also the Farm Bill. So we'll see if they pick up on that, and if I'm able to attend, I'll do my best to listen and participate.
Thank you.
Yeah, I'm attending that as well. So, Commissioner Stevens, is your hand raised?
It is. Thank you, Madam Chair. First of all, do we have any idea, will the Farm Bill, is it part of the continuing resolution that's kind of being proposed? Is there any possibility that it passes before the election? Or are we kind of going to, or do we have any of that kind of information?
So they have been debating the Farm Bill as well as an alternative proposal from Bozeman from Montana, who is the committee chair. While the alternative proposal from him delays the measurement, the issue is it actually creates a more significant impact in the error rates themselves. So it would delay the measurement, but increase the percentage that states would have to pay if your error rates are over 6. Because my understanding is that the outcome that he was trying to draft this proposal around is that there would still be the same amount of money coming in from the errors, the fiscal penalties. And so rather than pay 10% or 15%, states would have to pay 20%. In order to delay it. So there's a little bit of a double-edged sword. So that's what they're debating is the existing Farm Bill and this alternative. And from what I last heard earlier this week, there has not been a lot of progress or movement. The Democrats on the committee have been holding very firm that it is a delay, but also a change to the penalties themselves. Otherwise, they're not willing to vote on it.
Just one follow-up, if you don't mind, Madam Chair.
Sure.
Are our nonprofits helping with any of this advocacy? Because they would be really good voices, or can they write letters? Because, I mean, I think about, the food bank. I mean, they're going to be hit hard if we can't, enroll as many folks and some of that kind of stuff. So, I mean, as we've engaged them in the model process that you guys talked about earlier, are there are there ways are they willing to do that with us, or, kind of write joint letters or lobby for some of this, knowing that these are, that they can't handle, what might come if some of these drastic things happen.
So I don't want to speak on behalf of the food bank, but Amy and I had this exact conversation when Senator Hickenlooper visited. I do know that they are leveraging their statewide association, Feeding Colorado, who is doing a lot of advocacy and lobbying. But I do think that local partners would be interested too if that was something that we wanted to do. Feeding Colorado is doing a lot of work.
Thank you.
Okay, let's proceed. I want to make sure we get through all that you want to do today. Thank you.
Thank you. So we are going to shift gears, and Shannon's going to walk us through our semi-annual fiscal update.
Thank you, Commissioners. So we're going to go pretty quickly through the first couple of slides. They're really more just reminders about our funding. So our allocations, the majority of our allocations are made up by state and federal funds, 75% typically, and then the county is required to pay a match to be able to draw down all of those state and federal funds. Got to get used to the clicker here. One other quick reminder on this slide, these are just some of the allocations that we'll be reviewing today. And just wanted to highlight that we don't have any flexibility between these allocations. So if we're overspent in one allocation, we can't take from another allocation to help pay for those over expenditures. So that's why we highlighted that there are a few things that, that we do have available to us in reserves, our TANF reserves, and our fund balance to help cover some of those over expenditures. And then lastly, when we talk about allocation closeout, all that means is that there are some counties that are unable to spend their full allocation amount. And so those funds are reverted back to the state and then spread out to other county departments who have over expenditures in their allocations. All right, so I'll move next to our benefits and community support allocations. First highlight is the Child Care Assistance Program, or CCAP. Our allocation for fiscal year 25-26 was $9 million. Our expenditures were $6.7 million, so we were underspent by $2.2 million. Part of the reason for that was because we are still on a freeze for CCAP. We were able to sell some of our CCAP allocation to Boulder County so that they could use it for their over expenditures. And for our next fiscal year, 26-27, we are anticipating an allocation decrease of about 9.4%. This is because the CDEC has reduced their overall appropriation by $20 million. So there's less appropriation to then allocate out to county departments. Heather, please.
So one very timely update. We were really waiting to see what the decrease in allocation would be for us, which they have told us is coming September. So now that we've seen what the decrease will mean to our allocation and where our spending was last year, we are at the point, and this will likely happen before we come back before you again in November, but I have asked the team to explore moving to a wait list. We are at the point where I think we can start to explore enrolling new families. We are 2 million underspent as the freeze has had its impact, and we know what the reduction will be. We can still safely move to a wait list so that when a family comes off the program, we can add a family back on. So we are working on those logistics. It's a lot of work to shift from a freeze to a wait list. It will take us some time. We do have to reprocess all of the cases for the families that are on the freeze list. So it will take us probably 60 days to be able to make that adjustment. And we are also working on all of the external communication to families, to providers, to community partners. So we don't have any of those details yet solidified, but I do anticipate here in the next 2 months that we'll be able to come back to you with more detail to make that shift.
I don't see this slide in our packet.
Oh, really?
I don't know, it's not in mine, what page?
Yes, keep going just a couple more.
Oh, that.
There we go.
Okay, sorry.
No.
I was like, wait a minute. I don't see it, thank you.
So we are exploring that and working with the State Department to make that shift in our administrative plan.
the administrative shift, will that take a lot of staff capacity and time to do? I mean, you said it
Yes,
will, but
it will.
that take away from these other HR1 things you're trying to do, or is that just in that department trying to do that shift?
No, so both and. It is timely to also make the shift before a lot of that work will start. But they are still pretty dedicated to just CCAP. They can process the other programs. So we do have the staff to do it, but it is going to be very time intensive to make that shift.
Okay, thank you. Commissioner Kapfalis.
Thank you. A couple of CCAP-related questions. Colorado Child Care Assistance Program. How often do families come off the CCAP, being served by CCAP, and for what reasons? That's my first.
So we've been on a freeze since February 1st
I
of
know that.
2024. We
Yeah.
have decreased 45% of the number of kids we're serving. So we have lost 45% of the kids from the program. They come off for a variety of reasons. Some families make different decisions that the parent is not going to work and so they stay home, or they move and they might transfer their CCAP case to another county.
But under normal times, and we may have forgotten what normal times look like, on an annual basis, I mean, do 10% of the folks being served by CCAP leave for a variety of reasons? That's where I'm going with the question.
We'd have to look back to pre-COVID, which we certainly can.
Oh, that's all right. I just,
But they are not leaving the program because they are reaching economic thresholds that they don't still need it.
so there are other reasons. That's important.
There are other reasons. They're still, I would say, barely making ends meet financially as a household, though.
Then my second CCAP-related question is, how will funds from the sales and use tax referendum 1B, I think there's some that we keep in the bank here that might potentially go to help with CCAP. Can you speak up to that?
They will. So we are working on those details. But
Yeah.
you all have, we are sticking to the direction that you all gave, I think, 2 years ago now, that 35% of the funding that they will receive through that contract will have to go directly to families. So approximately 35% of the programming, and they're figuring out a tiered approach. And so we'll have the update to you, I think, pretty soon. But they are very close to being able to implement that in early 27.
Okay, thank you.
Thank you, Heather. Let's keep going.
Thank you. So next, we're going to discuss our TANF and Colorado Works allocation. Our 25-26 allocation was 6.9 million. We did spend 7.1, so we had an over expenditure of $187,000. The closeout process did help cover quite a bit of that, and so our remaining deficit was 29,000. We'll be using our TANF reserves to be able to cover those over expenditures. Next is our Oh, sure, that'd be great. Thank you. Yeah, that would help. Thank you so much. Is our employment first allocation. This allocation is around close to $600,000. We, to date, have expended $214,000. You'll see that it looks like we're underspent by $370,000, but that's only because this allocation ends on a federal fiscal year, not the state fiscal year. So we are budgeted to expend that full allocation. And next year's allocation, we are expecting a very small 0.1% decrease of $850,000. Our Office on Aging budget, our allocation, my apologies, was $3.3 million. We were overspent by $147,000, but we have carryover funds every year. And we specifically budget to our allocation and those carryover funds. So the carryover funds are what will cover that over expenditure of $147,000. And if we are unable to spend those carryover funds, the state will take those back. All right, next up is our Community Services Block Grant. So our 25-26 allocation was $584,000. To date, we have expended $286,000 and have $298 remaining. These services, this block grant, we're specifically using for supportive services for TANF and SNAP participants. We know that these folks have barriers due to their work requirements and their ability to access housing, and so we're specifically using those funds to help with rental assistance. And we do plan to spend that full allocation. This is based on the calendar year, so that's why it looks like we're underspent there. Our county administration allocation is specific for SNAP and Medicaid. So the CDHS, or Colorado Department of Human Services, portion of that allocation is specifically for SNAP. Our allocation amount was 5.9 million. We spent 6.3 million, so had an over expenditure of 424,000. Due to the closeout process and some additional federal drawdown that CDHS was able to get, we were covered 339,000 and have a remaining deficit of 85,000 that we'll be able to cover with our current budget. Our healthcare policy and finance portion of that allocation is for Medicaid. That allocation was 6 million. We were underspent by 26,000. Next year, for both the CDHS or SNAP and the HCPF and Medicaid allocations, we are expecting to have a decrease in both of those allocations for the next fiscal year. Now on to our child. Oh, yes. Oops, sorry. I completely forgot that line item. Okay, so there is a HR1 line item. So the Healthcare Policy and Financing Department went to the JBC this year and asked for $1 million, or my apologies. How many million was it? 17 million to help cover the costs of some of the changes that we're having to implement for HR1 work requirements. The JBC did agree to this 17 million for this particular fiscal year. Healthcare Policy and Finance has committed to going back to the JBC next year to hopefully get that same allocation amount for fiscal year 28. There are very specific things that we can use this allocation for, but we did receive 1 million for this allocation. And there was one other point that we wanted to make sure to cover, that the Department of Healthcare Policy and Finance has been saying that they would also potentially use this funding to bridge the gap between the current and future state of cohorts as well. But this is something that counties are a bit concerned about.
Thank you for sharing that news as well.
You're welcome. All right, now on to our child welfare. So our child welfare block was 22 million, the allocation. We expended by 800, or no, that's not true. Our expenditures were 22,900. So our over expenditure was 892,000 in this particular area. As part of the closeout process, we were fully covered for that over expenditure. In child welfare staffing, 1.1 million for the 25-26 allocation, over expended by 218,000, and we were fully closed out, and that over expenditure was covered by other counties' allocations that were underspent. Our child welfare core, our allocation amount was 3.9 million. We spent 4.2 million. So those $380,000 of over expenditures were also covered by our closeout process. One thing that we did want to highlight here for you'll notice their allocation formula for next year, well, not the formula itself has changed, but you'll notice that our allocation is changing quite a bit. So you'll see that in our core allocation, 676,000 will get less, but we will get an increase in our child welfare block and our child welfare staffing. So there's one thing that we wanted to note here specifically. Those changes are because of the new child welfare allocation methodology that has just gone into place. The CDHS, Colorado Department of Human Services, specifically wanted to move the core service dollars into the block. This is very concerning to counties. And the reason why is because this could potentially impact the amount of 4E federal dollars that we're able to draw down. So Larimer County is specifically going to continue our spending behavior the way that we have for our core services so that we can continue to get that 4E drawdown and as much as we can, but we are going to be monitoring it very closely to make sure that we are still staying within our allocation because these allocations do close out to each other. So if we overexpend in core and we underexpend in child welfare block, then we can cover those over expenditures with the block. All right. And then last but not least is our adult protective services allocation. Our 25-26 allocation is a minimal 1.4 million to serve a large population. Our expenditures, we did overexpend by $446,000. Through the closeout process, we were able to receive 158, so our remaining balance is 287. And you'll notice too that we will be getting a 3.4% decrease in our allocation next year. We are watching this very closely. Adult Protective Services teams have moved over into the Child, Youth, and Family and Adult Protective Services division. So we really are analyzing all cost reduction strategies. We are not filling vacancies that we currently have and trying to evaluate different ways that we could help to fund these particular services.
Let me just, I don't see, did your hand up, and then I'll be after you, Commissioner Stevens. I just think I need to think about that. Go ahead.
So my question is like, in the closeout process, we've been able to sort of recoup some of the dollars. Like, do we feel, I mean, and I'm sure it's maybe different for different programs, but some of the concern is sort of like, will those dollars always be available to be able to, like, are you, in future budgets, are you kind of looking at, well, it sounds like you already are, of like this, you know, we might not get these dollars, we might be able to use other funds, we got to stay within our means. I'm sure you're constantly sort of, and you guys have such a moving target here always. God bless you for the work that you do. Just, do you feel like some of those dollars and some of these funds are going to be available, knowing the state and knowing kind of the fluidity of sort of funding at the federal level? I mean, how are you feeling about the future for being able to cover things when we have these overages in the future in some of these different areas?
So we have, we're finalizing our budget. We will be submitting it a couple of weeks later than the other departments. We're very appreciative of the extension because we have hit that point where we anticipate that coverage at closeout is really, this is very likely the last year that we will receive the coverage that we have. And we have seen that over the last several years. So in child welfare in particular, it was not that long ago where we were 4 to 5 million overspent. And so we have been intentionally reducing those over expenditures because the coverage is less and less each year. And there was 13 million at closeout that did not get covered for other counties. 13 million that counties larger than us had to cover from their own county general funds, their mill levies, the year before it was 9 million. So it is growing more and more. And I think this is very likely the last year that we will get this level of closeout because the funding is gone. The federal drawdown in child welfare in particular continues to decrease. So there's a lot of work happening, and CCI is already meeting with JBC staffers to try to analyze that and help them understand. So I do think that this is the last year that we will see the level of closeout that we have, but it's been a downward trend for probably the last 4 years.
Thank you. And I think that's really important for the public to hear as we have those conversations of that you're not only aware of that, you've been making cuts and efficiencies to be able to operate in a world where we're not going to get any additional dollars from the federal or state government to help us with closeout and take care of these additional costs that we incurred for helping people in our community, right? I mean, good work, and, there's only so much that we can do. And so I think, I'm so appreciative of the fact that, we're not in the position that other counties are, where we're having to find tens of millions of dollars to be able to cover these programs. On the other hand, obviously, we're still trying to deliver those really good services. And so there again, as you work with your staffs, please thank them for that work and appreciate the outreach that, Kim and Jonathan were talking about of, that's why we check in with one another, because we know we're all in this environment where the work is no longer, well, it was never easy and it's harder. So Thank you.
Thank you.
Yeah, just, I guess overall, just every single staff member, and it seems like everyone is doing their utmost and above and beyond, just trying to navigate really challenging and certain times that are really unprecedented. I hate to use those words, but it is. So we appreciate it, everyone. And you, Heather, too, because you've been at a lot of extra meetings, and then being with Senator Hickenlooper and trying to be an advocate, it's been really important. So
Thank you. Okay, any other questions on the fiscal update?
I guess one quick question for me is, when we add all of these up, there's an accumulation effect. What are we really anticipating for next year with all the decreases and uncertainty? I mean, I started kind of rounding up and adding in my head, but what are we really thinking or preparing for? Maybe mid-case scenario, not worst or best, maybe just mid-case.
So this year is no different than any of the prior years, where we are constantly going through what are we mandated to continue to provide, what are we potentially providing, even in how we do the work day to day that we need to adjust. So Shannon spoke about the APS analysis. There is a lot of, we haven't had as much conversation about it, but there is a lot of mandated procedure day in and day out that does not impact adult safety, but we're required to do it, and it drives a workload. So I really appreciate Thad's analytical brain, and as he's taken those teams on, he's really digging in to understand what are their caseloads and what is the complexity of their caseload, and how do we adjust expenditures there, just like we have in the child welfare space. And what that has meant is, unfortunately, higher caseloads for caseworkers too. So I know that that has been difficult, so we watch that, but it has meant holding on vacancies and allowing their caseloads to grow within reasonable and safe measures, but it has meant increased caseloads. The other, I would say, significant shift that we are anticipating making as we go into '27 is not being able to hold vacancies as much as we have. So I do think we will see a reduction in vacancy savings. We've been holding on to vacancies in the eligibility space as long as we possibly can, as much as we possibly can. And when we know how long it takes to get through the food assistance and the Medicaid training, we need to start putting new staff in those vacancies now to be prepared to work the caseload a year from now. So I think, and we can highlight the specifics in our budget submittal, but a reduction in the vacancy savings, which then will also have that impact on the overall budget itself. But we're still working through some of those details to really be able to, we just got all of this data at the end of last week, so we're pulling it all together, but I know that we won't be able to hold on the vacancies that we have been. We have to start gearing up in the staffing for these changes.
That's what I was kind of thinking too. Okay, thank you.
All right, so with that, we are going to turn over to Thad. Even though we have had the reduction of expenditures, Thad has been driving a lot of strategic work and is seeing some really cool outcomes in the last 9 to 12 months. So turn it over to you, Thad, and he's going to share the new division name too.
Yeah, so Thad Paul, Division Manager for Child, Youth, Family, and Adult Protective Services. Once we bring them over, we want to be fully inclusive in our division. So our abbreviation is CYFA, and we only added a letter, but we added a whole team, right? And so that's the messaging that we're giving. What I'm going to share is very specific to child welfare, and I'll walk through some of these outcomes that you'll see here, but wanted to set the stage a little bit. So super excited that I get to present to you, because I've been telling my staff that I'm tooting their horns everywhere I can, and I tooted it to Heather and Shannon, and they said, well, why don't you toot it to the commissioner? So here we are. So to give you a little context, in child welfare in our county and most every other counties, it's still a very siloed work environment. Child protection workers are doing their work, and then the service teams workers are focused on their work, and there's a lot of disconnect that historically would happen between the opportunities to kind of cross over and support each other. So in November of last year, we launched our new teaming initiative, if you will. And in that teaming initiative, it was a very strategic shift in maximizing the successes we were seeing in pockets when we would have really good teaming across service teams and child protection team workers in delivering really great outcomes to making that as the expectation of the work across the department and refocusing that everybody's outcome is the child and family outcome. So it's really, that is easy to stay focused on that in the child, as the child protection worker, that is our outcome. But when you're a worker supporting a foster family or a kinship family, it's easy to get focused on the outcome and the success of them. But ultimately, their success improves the success of the child and family. And so it's trying to help it to kind of connect those dots. So when we stepped into the teaming model, and teaming is a very big umbrella with lots of little, I don't know, spindles, I don't know what the right term is underneath that umbrella, to kind of what teaming looks like on a day-to-day practice. When we launched this in November, really the emphasis at that point in time is we were going to identify 12 cases that we would identify to do action planning on. And so when I say action planning, this is like initially our whole division viewed that action plan cases is teaming, and that is just one component of teaming, and I'll walk that through a little bit. But we started in November 1st, and we brought all of our managers together, and every case carrying team had to bring a case in that they felt like would benefit from teaming to move the needle on those kids that were out of home and get them to permanency quickly. The reason, and that's work that we do all the time, like that's a regular work that would happen in the context of a supervisor. What is different in this space is each of my deputy division managers became responsible for facilitating and managing the teaming model specific to those action plan cases. So when we say an action plan case, they would come together and facilitate, and historically, oftentimes you would have a group supervision and a caseworker, the child protection caseworker would have a laundry list of items to walking away with to do. Now what it is our deputies walk through and assign those activities to other members of the team, forcing that interaction and forcing that teaming of, it is no longer just the child protection caseworker's job, it is your job to help support that specific event. A good example would be we have family time facilitators that supervise family time. They have really deep connections with our parents, and oftentimes are the best deliverer of messages or re-engagement opportunities with families that have been disconnected. Historically, that would be the caseworker doing the chase. Now we're having them do the chase because they have a relationship and a different lens that is able to kind of bring the family back in. So that's just a small example. We moved, so teaming also looks like moving to the front end, moving a lot of work to the front end. And so in our hub, we have moved all of our background checks now occur on our front end staff instead of being taking up time away from casework staff. We moved it to our hub staff. And in addition, they are also doing what are called accurate searches on every assessment. So we're helping to find all family members that might be a support on the front end assessment, so the caseworker can take that and have that conversation with the family and say, hey, here's a list, let's talk about who of these folks on this list might be really good supports with you, so we can really wrap around the support network, instead of historically it was that could happen, but it was required, the caseworker had to initiate the ask instead of having it available to them on the front end. We've also moved to create some administrative efficiencies. We actually are leveraging technology to help support the writing of safe studies for our foster care workers so they have more times to be more engaged in other teaming models. What else? We're assigning family meeting facilitators at basically 10 days after the assessment has been initiated. The purpose of this is historically the caseworker would initiate a family meeting, but they would have to be the one initiating it. Now we have the family meeting facilitator reaching out to the caseworker saying, hey, you're at day 10. How about we start working on developing a family meeting so that we can have the family develop the plan? So instead of the caseworker initiating, we're running to the work instead of the caseworker having to reach out to ask for the support systems. And then kind of a little nuances, two additional kind of teaming spindles, if you will. We have a lot of internal communications that are happening either through Zoom chats or email channels that are basically, I need help on this case, something's blowing up, can somebody do this X, Y, and Z that is happening? And this now goes out to the division-wide, and the number of people that jump in to support their peers that they are not connected to is just, I mean, it spurs that environment, right? It spurs the culture of I'm willing, somebody else help me, I'm going to help somebody else, and it's just a circular thing that is just really beautiful to see. And then just this last month we had our another CYFA all-staff event. In that CYF all-staff event, we actually launched a cohort model. So we mixed up 16 or 18 different cohorts, and each cohort is a cross-section of staff that are not connected to the teams they've been on, and that is their cohort for the next year. So that provides opportunity for them to start learning from expertise from other folks. And in that teaming event, what we did is we really allowed everybody to share their zones of brilliance, what they're really good at, so that people in their cohort go, oh, God, you're really good at this, and I suck. I'm not really good at this activity. I'm going to start leveraging you to help support that teaming. So really, this is not just about how it shows up with families. It's about how the culture informs how we show up for families. And I just wanted to highlight that as kind of the context of where we're stepping into. So our initial targets for teaming were really to improve placement stability, reduce out-of-home placements, increase permanency, and create some administrative capacity, AKA reduce our costs, and increase consistency. So I highlighted a few of our outcomes that you'll see there. So November 1 is our launch of teaming. You'll notice there we had 208 kids at that point in time that were under the age of 18 in our custody. As of October 1st, 2026, we now have 145. So in just that 8-month period, we had a 30% reduction of the number of kids that are in and out of home care. If you see that little bullet underneath the chart there, this last fiscal year, we had the fewest number of children enter our custody ever, or at least, and I'll say ever, maybe that's really too long. I would say as long as I've been here, which feels like forever, and it's been 29 years. So that is the lowest number we've had in at least 29 years. And it is pretty substantial in that it was a 40% decrease compared to where we were last state fiscal year. So we really have moved the needle on the front end. Again, we started on the back end, let's get kids out, but really what is happening is the teaming model is integrating into the front end and really getting in front of having to take removal at all. So super exciting, proud of the intense work that my staff are doing in that space. The next one is that child placed in child placement agencies. We reference those as CPAs. The reason that was a focus is CPAs are a family-like setting. They are a private foster care. But more often than not, CPA placements means those kids had to leave our community and go to another community setting because most of the CPA placements are in other counties, right? So you're getting them farther away from their parents and visits and all those kind of things. And in addition, CPAs cost us more money. They have an administrative cost to perform that function. So you don't just pay the foster care rate, you're also paying the administrative rate for those child placement agencies. So that was a very dedicated target to continue to get shrink our budget or expenditures to get more in line with our allocations, or under allocations, I might highlight. But it is where we are. But what is just amazing is that amount of time we've reduced that number by 62%. That is just, like, you set goals. When I set these goals, some of these goals, you start thinking 10%. If you're moving the bar 30, 60% in 8 months, that's just unheard of in child welfare. So super excited about that. And then we've had children achieving permanency since that time. So I kind of went back in the prior 9 months. That 85 number for November 1st of 2045, that's how many kids achieved permanency in the prior 9 months. This 112 is how much we have achieved, how many kids have achieved permanency since November 1st. So just another example of the massive increase of getting kids out of the back end of our system as well as slowing down the front end of our system. And then lastly, to highlight is that placement moves rate. So there is a state measure, it's a placement moves, number of children taken into custody per 1,000 in population. That's what that 2.3 represents. So we went in November 1st of 2025, we were 2.3, and I think we were probably eighth worst of the Big 11 counties in that rate. We are now number 1 in that Big 11 in the Big 11 at a 1.39 rate. It gives me goosebumps to think about how fast we move the needle, and just all the kudos go to the staff because it's dedicated and a whole lot more effort to do this type of work than just to do I'm in my little pocket and this is what I do. So thanks for the opportunity to share. It's a lot of fun to get to share some successes sometimes.
I see that we're certainly going to have questions from all three of us. Start with Commissioner Stevens. Thank you. And thank you, Thad.
I don't have any questions. I just want to gush on this. This is amazing. I mean, to move those numbers in that, at that level in that short amount of time is remarkable. So yes, kudos to your staff and kudos to you for creating the model and creating the culture where people can thrive and do the work even better than they've already done it. Because I don't think we ever did the work poorly, but to make those kind of changes, which are outcomes for families that are better and kiddos. And so that's so great. And then, not to mention the money part, that's always good. But I mean, the fact of the matter is this is helping families, have better outcomes and have kids stay in our community and have kids not in a system as long. And so I can't say enough good things about this. So yes, I'm so glad you shared this. It is wonderful to have great news. We don't always, I'm sure in your world you don't always hear it. And so there again, just very awed by the changes. And I'm like, the teaming model, how can I implement that in my world now? Because I want to have get 60% better at something too. Very, very good. No questions, but kudos to everyone. And please pass on our thanks to your staff for really figuring out way to solve some of these really tricky problems in a very innovative way.
Thank you, Commissioner.
Commissioner Kapfalis.
Thank you. I'm hoping that after we adjourn, that we can do a high five. So this is, as Commissioner Stevens said, this is really fantastic and a good way to end our conversation today. Thank you very much. And it goes without saying, please express our gratitude to your team. Go back and give them all hugs for us or something like that. And I have two questions. Don't want to let you off too easy.
Oh, here we go.
My first question is, of the children that do have to go into foster care, what percentage of those foster care settings are kinship foster care? I think that's important information.
Our most recent number was 69%. Most recent number was 69%. Most other counties' average is 45%.
So that's another good number. Yes, you're on a roll here, Thad.
coming.
On that CFA team.
That's
My second question and my last question is, by any chance, is the state paying attention to this and saying, this is great, we need to make sure that other counties are using these models, the cohort model, the teaming model? So is the state paying attention and maybe at least giving us a pat on the back or something?
They aren't calling it out what I would say is what's more important is I'm sharing this with other counties and they're having interest in outreach and we're having those conversations. Whether the state wants to do something, it's really the counties that matter, honestly. It's that relationship. And so I already have a couple different meetings with a couple of different counties to kind of share the work we're doing.
I agree, but indeed the state needs to be aware
Of the movement.
how often, things are working well at the county level, because we're the ones that actually do the work. And I think that informs some of this reorg work.
Yeah.
And I mean, this is an example of how we're doing really great stuff in Larimer County.
Yeah.
Thank you.
Thank you.
Well, Thad, you have been, Heather and your whole team, but Thad, you have always impressed me from day one. When you brought us out to do some packing of bags out at the Realities for Children, we were out there packing diapers and bags and food, and what was that called, Suds Drive? Yeah, I remember that. So just amazing. It's just so grateful you work here and that we benefit from your work, but also just the empowerment you give to your team and those folks who joined in on this, because you have to have willing staff and partners, not to just say you will do this, but to get that buy-in. So my first two questions are, I have a few questions about that. First, the public's listening or maybe the press, how do you explain this to everyday residents who are trying to understand what is teaming? And what does this mean and why? This sounds like it made a big difference, but I don't understand what this means. So I'm just wondering how you would explain that to, if I was in the grocery store and someone said, I heard about you guys had a big success. How would I explain that?
I would say if you're in the grocery store, you could liken it to, so you go and you check out and somebody's checking you out and then somebody's bagging you. And they have very distinct jobs or roles. And in the teaming model, the person that's checking out is actually maybe doing something in addition to just bagging it. They are helping the checkout person, right? So I think if, just to dumb it down to that kind of simple and comparison is basically your job and your role is this. Historically, you've always been to do this, but now I'm going to ask you to go have a conversation with a family member that you historically wouldn't talk to, is only the caseworker. And so it's actually creating who's the best person to have the best conversation and the best opportunity to move the needle. And so in any business, there's a lot of staff all up and down a continuum of a hierarchy that have different skill sets that don't get leveraged to do the right thing at the right moment, and it's really finding the people that have the best skill set to do the right thing at the right moment.
So almost like calling a friend.
Calling a friend, yeah.
Calling a friend.
Calling a friend that's really good at something.
Yeah.
I think the other piece I would add is, and you mentioned this a couple of times, that it takes the responsibility away from the caseworker to always have to be the one to ask for help with their caseload. And instead, it sort of highlights where help is needed, and removing that responsibility when you feel overwhelmed and overloaded with your workload. Sometimes it feels like it's just going to be more work to ask for help. So I think that shared responsibility too is really crucial.
And I think we're all, even in life, we all just say, it's easier if I just do it myself, because if I try to explain what's going on, it would be more work, and then I'm going to get more down, right? But obviously, this is showing that that's not the case. So go, I see you want to say something else to that.
I was just going to say, to Heather's point, like, I have examples that are happening in our internal communication. Instead of just people saying, hey, I could use help with this, I have a caseworker that periodically says, hey, I'm up on first assignment for assessments today. I'm not getting anything. I have a little time. Anybody need anything? So it's that kind of stuff that is just, like, that empowers others to say, oh, my God, I have a little downtime right now. Instead of my 15-minute whatever I was going to do, let me offer somebody else to do something for him. And it's just that kind of, that it breeds a culture,
That's
that
great.
opportunity, yeah.
And so when you talk about, of course, when you did this cohort for the next year, and you have all these new cohorts that you reformed and things, how are you tracking, with this, but also, you guys had that system where you guys were sending the little cups and kind of tracking how people, or the app, remember, you were tracking how they were feeling. How are you tracking that? I know those come and go, but how are you tracking how that also these are phenomenal numbers. This is why we do the work. But we all worry about all of you and all of us with going through all of this. This is really a really stressful time. How are you also seeing how that, you talked about building culture, and this, when you were naming that off, it was like guiding principle there, guiding principle there, guiding principle there, right? And so that's kind of just embedded. It's not just the thing on the wall. We do this all the time, every day. So how are you tracking, or can you track how that might have changed stress levels or innovation, attitude, culture at work, that's maybe this is, together we can get through this? So I'm just curious.
There's lots of ways, and I know Heather's ready to weigh in, but for sure the HR.
I know she's sitting there waiting. I'm ready to say.
The HR survey, we leverage the HR survey every year, and so we will be able to see some of those impacts through the HR survey. We do comparisons as a leadership team about what was showing up last year to this year, so it'll show up there. We have a lot of peer programming, internal peer programming, including Resilience Alliance groups and peer ambassadors, and so it'll show up in those conversations. In child welfare, in CYFA, we have a very intensive strategic planning steering committee that's happening, and we have a whole lot of committee work that's happening with the boots on the ground folks informing our practice, and so we're hearing it through that. We have all kinds of opportunities to submit anonymous or non-anonymous feedback, and so it'll show up. It's just maybe not as tangible as what that app used to be, if that makes sense. But we that is a very big focus of Heather's, and we use all those different tools to evaluate. Did I miss any?
No, I was going to say, I was thinking a lot of the same thing, and I also made a note. I think November would be a great time for us to bring a Science of Hope update back to you on how we are still using the Science of Hope, I would say even in more expanded ways than we were when we first brought it to you. And we're getting ready to launch our next annual Hope Scale. And so we've taken those Science of Hope questions and we've built in burnout questions to that scale too. So I think November would be a great time to bring that back and share, because it touches on all of what we've talked about today.
And I know my other commissioners don't know, but, CSU and Dr. Finders had reached out, and I'm glad she did, because her and I already had a conversation, what I think would be cool at a commissioner level to track, but I could see already, I'm glad you're reaching out to her, and that, I'm just wondering what she could help with that as well. So I'm really grateful for that, to help and have that offer. So, wow. Even with all these things that are just been pressing, to be innovative and think outside the box, and not only to take care and challenge staff to be innovative and work together and kind of do this, but also just to have these absolutely outstanding, impressive outcomes. But really what this comes down to is this is for the kids, and this is what's best for them, and this is going to impact a generation of children who have received better care. So, not because we weren't doing a good job, but because we keep trying to do better. So, just wow, thank you.
Thank you, Commissioner, and I appreciate the kudos to me, but the kudos is my staff. I mean, Jonathan was one of my deputies that was helping to lead this initiative, so I want to give some kudos next to me, but my deputy division managers, they carry a lot of the weight of this as well, and they are running with it, and I couldn't do it without my team, so thank you.
Well, I know that, but they all follow your leadership, Stu, but thank you to everyone. And boy, with that, I wish I had 1,000 nectar points today. I'd be like, but anyway, thank you very much. This is just really a good way to end. So is there any more, or are we done?
I think we are done. I was just going to say, we always take snippets from the broadcasts of these and share them back out with staff. So we will do the same with this, so our staff will be able to see and hear the kudos directly from you too. So
Awesome.
Thank you.
Well, huge kudos to every single person in Human Services. What an amazing job, and what you guys are doing. So it just makes me have a lot of hope. So, well, kudos to everybody. Lorinda, you get the last word, besides me adjourning.
As I listen to all of this, and I think about these error rates going down and what CYFA has done, adversity can either inspire or it can do the opposite. And you all have taken it and really tried to make it into a positive. How do we get creative? How do we get innovative? How do we get collective thought from staff, learn from them, and engage them in the solutions? Kudos to everyone for that. I think that speaks to the leadership team and it speaks to the staff in Human Services. So thank you to you. Thank you to all of them. It's amazing work. I always wonder as I look at these slides and think, oh, this is going to be hard to hear and it's going to be hard to go through. And that is not how it ever turns out. So you're able to somehow turn that into inspiration. And thanks for doing that.
Yeah, thanks for doing that. Well said. Well, thank you all for being here today. Great way to end all the other procedures and informations. But at 3:21, we have no further business and we are adjourned. Have a wonderful afternoon. Thank you.
Thank you.